Hey everyone, my name is Jessica. I'm a board-certified pediatric nurse practitioner and a first-time mom, here to help you feel a little more confident navigating all the curveballs parenthood throws your way. Today we're going to talk about a big one, hand, foot, mouth disease. Yep, that pesky virus that spreads through daycare like glitter on a preschool craft table. Today we're going to talk about what it is, how do kids get it, and when to worry. Let's get to it. So first things first, what is it? Hand-foot-mouth disease, or HFMD for short, is a viral illness most commonly caused by Coxsackie virus. Basically, when the virus enters your child's body, it sets camp in the intestines and the throat, eventually spreading through the bloodstream and affecting their skin and mucous membranes. Hence, the hallmark blisters that you see in their hands, foot, and inside the mouth. Sometimes you can also see it in their buttocks and in their legs, and although it looks kind of scary, it's usually mild and it goes away on its own. So what causes it? The main culprit is Coxsackie virus A16, and other enteroviruses can cause it too. It's not a bacteria, so you won't need antibiotics. That's the most common misconceptions I've seen with parents. Since it's a virus, you just gotta let it run its course. So when is it most common? Hand-foot-mouth loves warm weather, so you typically would see it between summer and fall months, around July to September. So when your kid has a fever or rash and are refusing to eat around those times, hand-foot-mouth should definitely be on your radar. So what population typically gets it? Most commonly, I see this with children under 5 years old, especially when they're in daycare and in preschool. Although bigger kids and adults can get it too, usually it's milder, but the hot spot is daycares. Usually with one kid or one baby having hand-foot-mouth, half the class usually goes home with the exact same symptoms. I am seeing a lot right now, so this is why it prompted me to make this video. So how does it spread? Here's the fun part. Hand-foot-mouth disease spreads through all the glamorous things that kids love to share. Number 1, saliva, through coughing or sneezing. Fluid, from blisters. And number 3, poop particles. Yes, from poop. Those diaper changes are a main culprit. The virus can live on surfaces and toys, which makes playrooms basically a viral paradise. Kids are most contagious in that first week, but the virus can continue to shed in their stool weeks afterwards. So we'll talk about prevention later on in the video. So what are the signs and symptoms? Classic signs of HFMD include number 1, fever. Usually that's the first thing that comes up. Number 2, painful mouth sores or ulcers. So sometimes you see that on the cheek, on the back of their throat, soft palate, tongue, around the mouth can happen as well, and it's very difficult for them to eat or drink because of these sores. Number 3, the rash, the actual rash that you see in their hand, their foot, or even in their buttocks. You'll see that. Sometimes it starts off as a flat red spot and then it becomes blisters. And number 4, general crankiness. They usually don't want to eat or drink. Not every child will have all 3. Hand, foot, and mouth involvement may vary. Some of them just have the mouth ulcers or the sores, and then some of them just have the rash and none on the mouth. So now let's talk about prevention. Prevention is all about good hygiene. If you think of good hygiene, the first thing you should think about is washing your hands. So especially after diaper changes, coughing, sneezing, blowing your nose, and try to make it at least 20 seconds. Teach your kid how to wash their hands properly so that you can minimize that spread, because they are the main source of it, right? So number 2 is to disinfect all surfaces and toys as best as you can. And then number 3 is to avoid touching your face or their face, or if you do, just make sure that you wash your hands after. And then number 4 is to try to keep sick kids at home until they're fever-free for 24 hours and they're feeling overall better. The key here is minimizing the spread of the infection. So now your kid got diagnosed, the signs and symptoms are there, you know what caused it. What is the treatment plan? What do you do to help? So with this, it is a virus, so there's really no antibiotics or anything else that you need to give, because you can't cure it. You just have to do supportive care, which just means that you have to just keep them as comfortable as you can for them to get through the symptoms and have the virus run its own course. So number 1, Tylenol or ibuprofen if it's age appropriate for pain and for fevers. Number 2 is to just give them cool liquids, smoothies, popsicles, anything to kind of soothe the pain, especially if they have mouth sores. Number 3 would probably be avoiding acidic or spicy foods, because this can really sting those sores in the mouth. And then number 4 would probably just giving them lots of rest and lots of cuddles. So typically resolution for symptoms occur about 7 to 10 days after the onset, after it starts. So here's the real question. When can my kid go back to school or daycare? Very fair question. The American Academy of Pediatrics and the CDC recommend that kids go back to school when they're fever-free for 24 hours without medicine and when they're feeling overall better. The blisters don't have to be completely gone, because this can last for a little bit, but they have to be healing and not open and oozing. Bottom line is, if your child is feeling miserable, keep them home. But if they're feeling better, eating, playing, drinking, and fever-free, they can usually go back to school. So now let's talk about warning signs, when you should call your provider and get medical attention immediately. Number 1 is signs of dehydration. So you know how I talked about earlier that they can have oral ulcers and oral sores that it makes it very hard for them to eat or drink. They can get dehydrated because of this. So signs could be dry and cracked lips, very few wet diapers. When they're crying, there's just nothing coming out, no tears are coming out. Number 2 is just high fevers that won't come down even if you've tried Tylenol or ibuprofen. Number 3 is just when they're having difficulty breathing or difficulty swallowing. Number 4 is when they're unusually sleepy or they're difficult to wake up. And lastly is when their rash just looks unusual and it's spreading very quickly. Like I said, most cases are mild, but when they're having these warning signs, definitely need to see your provider right away. So there you have it, hand-foot-mouth disease explained without the panic. It's messy, it's uncomfortable, but it's usually short-lived. Parents, hang in there, you'll get through it. If you found this video helpful, then I did my job. Don't forget to like this video, comment down below with all your struggles with hand-foot-mouth disease with your kiddo, subscribe to my channel for more child health tips, and share this with a friend whose kiddo seems to just be getting everything in daycare. See you next time.